Startling statistics tonight about teens and their ability to access guns. 1 in 4 teens say they can get a loaded gun within 24 hours. And over 1 in 10 say they can get a loaded firearm in under 10 minutes. That's according to results from a Healthy Kids Colorado survey. I spoke to one of the researchers who published the findings in the medical journal JAMA Pediatrics.
Access to guns matters.
Ginny McCarthy is a doctoral student at the Colorado School of Public Health and one of the authors of a new research letter released Monday in the medical journal JAMA Pediatrics.
These are uncomfortable subjects, both the idea of firearm access and ownership.
The letter examines how quickly Colorado's children and teens can access a loaded gun.
Time to access matters because we see that for suicidal ideation to action, oftentimes that time period is under 10 minutes.
Much of the data comes from a 2021 Healthy Kids Colorado survey. In this research, more than 41,000 Colorado public middle and high school students participated. The focus, access to firearms and suicide.
They could report under 10 minutes, 10 minutes to an hour, 1 hour to 4 hours, 4 hours to 24 hours, and over 24 hours. And then there was also an option for no access.
How are they getting a hold of these guns?
In the survey, we aren't able to answer that question based on the survey data. We do know that nearly a quarter of completed suicides among youth and adolescents do occur with a firearm that they obtain outside the home.
McCarthy says addressing the topic of access with youth and teens isn't easy, but it needs to be done.
I think understanding first that we have to talk about it. It's oftentimes a very private conversation. People aren't very willing to have that conversation, or they're afraid that the reason we're having the conversation is because someone wants to control use or ownership.
She says there's a lot of misconceptions when it comes to the issue of firearms.
If there is an instance where someone might suggest removal of a firearm from the home, it can be temporary. It can be just during a moment of heightened concern. And if we can start to minimize some of the stigma and shame about talking about mental health and we can increase resources for teens, we can create a safer environment.
McCarthy says it's so important to continue to study these trends over time. That way we will know what strategies are effective or not by analyzing how patterns change.